Hello friends, welcome to Creative Medicine. In this lecture, we will learn about
Now, in the medical therapy of glaucoma, we have drugs like we have a drug called as netarsudil. We have netarsudil 0.05% ophthalmic solution. This netarsudil inhibits the Rho associated protein kinase. When it inhibits the Rho associated protein kinase, or by inhibiting the Rho associated protein kinase, it will increase the drainage. That is one mechanism. This netarsudil will also cause norepinephrine transporter. It will also inhibit the norepinephrine transporter. So by inhibiting the norepinephrine transporters, it causes reduced aqueous production. So as a result, this netarsudil is actually an agent which will has two things. It will inhibit the Rho kinase and it will also inhibit the norepinephrine transporter. So it will both increases the drainage and reduces the production. So this is netarsudil.
thank you and thank you for watching.